Hi, good afternoon, and welcome to Facebook Live. I'm Dr. Acosta, and today I'll be talking about why losing weight can be so difficult and options available to help overcome weight loss barriers. As we come with the holidays and we're all enjoying the festivities, then it comes in January and we all have New Year's resolutions. And the majority of us will be thinking, so what I want to do this year and what's going to be my resolution? And many of us will consider adopting a weight loss goal, saying I want to lose 10, 20, or even more pounds this year. And unfortunately, what happened to most of our patients is that they will start January very aggressive, as I was talking with my patients this morning. And by mid-February, most of us will give up. And we blame it into many things. But in reality, the reason why sometimes these diets and weight loss programs don't work and people are not successful is because our body is not allowing us to be successful. Our body has many effects that wants to save energy. As I tell my patients usually, they want to keep those savings in ways of pounds and calories and fat in the bank. They don't want you to use them. And why does that happen? For example, every time we go into a diet, we feel extremely hungry. And that is because there is a hormone that we is produced in our stomach that goes to our brain and tells us we're hungry. When we go into a diet, that hormone was way up, and it makes us so difficult to try to stick to the diet. There's another hormone that is another good example, is that hormones that make us feel full, that should come from our gut, go to our brain and tells the brain, I'm full after a meal, they actually, in the contrary, go down. So we feel less full with those hormones. At the same time, when we're on a diet, and many of us have experienced this, we feel very specific cravings to things that we like or we're missing. Like if we're doing a diet low in carbohydrates, we're missing all our sweets. If we're doing other types of diets, we have particular cravings at certain times of the day. And it becomes so difficult to stick to that diet and exercise program. And finally, even if you're successful and you can regulate your food intake, there's this whole thing about energy expenditure. Our body starts saving those calories and that energy instead of burning it. We become machines that we go into hibernating mode. And for those of us that are here in the north, we understand what that means in the very cold, but actually everyone experiences that. Our body kind of shuts down and tries to save calories by burning less. That's what we call adaptive thermogenesis. So clearly, our body doesn't want to lose weight, even though we keep trying and we keep hearing from our doctors and our family and other friends saying, hey, it's important to lose weight to prevent conditions such as diabetes, hypertension, heart disease, cancer, joint problems, sleep apnea, and so on. So, what can we do? And this is what I was discussing with many of my patients this morning is we have many tools to help you be successful to that New Year's resolution and that diet and exercise program. The tools are vary in many things. First, we need to attempt a good diet and exercise program. If it can be supervised by a multidisciplinary team, it will be even better. But if that's not enough and we feel ourselves we're sleeping or not being as successful as we would like, it's worth considering using a tool like a medication to help you either suppress the appetite or make us feel full or work with those cravings. Or consider maybe a endoscopic device that is placed by a simple endoscopy in an outpatient unit. And this can be something like an intragastric balloon that we put in our stomach and we inflate it in the stomach and it helps us feel less hungry and more full. And then we can also go do other devices such as the endoscopic sleeve gastroplasty, in which by endoscopy, we suture down the stomach into a third of its size. So we don't have all those hormones going up to our brain and tell us we're hungry all the time and we can just attach to the diet. And finally, probably the most aggressive tool that we have, but the most successful, is bariatric surgery. And there are multiple types of bariatric surgery, from a lap band and laparoscopic sleeve gastrectomy or a Roux-en-Y gastric bypass. All those tools, medications, endoscopic devices, and surgery, have only one purpose: to help us stick with a diet and an exercise program so we're successful. So we should use it. So in the previous years, if you have attempted to lose weight and not been extremely successful, or you would think you need to lose a little bit more weight, it would be my expert advice to really consider adopting these tools in order to be successful with your diet and exercise program in this New Year's resolution. So who can offer these tools? There are many obesity experts, multidisciplinary teams around the country. including the one we have here at Mayo Clinic. And I feel very proud of saying that we have put a state-of-the-art team together in order to offer the best care for weight management and their complications. So in our team, we focus on introducing a very strong and well-supported diet and exercise program, supported by multiple levels of help, including a wellness coach, dietitians, behavioral psychologists, endocrinologists, gastroenterologists, surgeons, exercise physiologists, experts in resilience, experts in mindfulness, and a very comprehensive group in order to help you adopt your New Year's resolutions and be successful in your attempt for weight loss and to keep that weight off and maintain it throughout the year and more years to come. So we're very encouraged to present our team in a multidisciplinary team, which is a key successful for introducing these tools. So once these tools have been introduced, it's most likely that you'll be successful in maintaining the weight off and keeping it off. So that's what I want to introduce today. And I think we have some questions from our audience. So I'm going to start with our first questions. The question says, what advice do you have for those who feel certain medications make it more difficult to lose or control weight? That's a terrific question because many people have gained weight or are gaining weight because of medications that were used for treating some conditions. The most common examples of medications that produce weight gain are things like prednisone or some anti-depression medications produce weight gain. So the first thing is to discuss with your medical providers if those can be switched to an alternative medication that is more weight neutral, so doesn't produce weight gain, or that helps you with weight loss. If that's not an option, sometimes that's not available, it's important to consider how they are working and identify the right dose for the right condition. For example, with antidepressants, can we come to a lower dose so we don't have side effects? And then the last thing is, with modern technology and pharmacogenomics, we can see if you're in the right dose based on your specific metabolites, your specific genomic code, and make sure that the doses are appropriate. So in summary, for medications, try to get off of them if you can. If not, find the right dose for the right patient. And I think that's a key first step in order to try to lose weight if you're having something that is producing you weight gain. I'm going to move to the next question. I have Hashimoto's disease. That's a disease of the thyroid. Just for everyone else, does it really makes it more difficult to lose weight or is just an excuse? So when patients have thyroid problems, the studies have shown us that they do gain a few more kilograms. But in reality, it's not more than 5 kilograms, maybe 10 or 10 to 20 pounds. So if you have a thyroid problem, if you have gained 50 to 100 pounds or of excess of your weight, that's probably just driving your slow metabolism, but it's not all the blame for. Clearly, if you want to lose weight, that something needs to be addressed and your thyroid needs to be well controlled with supplementation. And then you need to focus on identifying what will be your best approach for weight loss. Okay, we'll take a water break. All right, so the next question, and please keep them coming, I'm happy to answer them. How does one lose weight gain during binge eating disorder? Are there any treatments for binge eating disorder? Yes, they are. I prefer not to go to any of the specifics of the medications, but there's actually just one medication approved for binge eating disorder. And if you have diagnosed this disorder and you think you're gaining weight or have difficulty losing weight, I would recommend you talk with either a psychologist, psychiatrist, or with an obesity expert that can help you address this disorder and manage it appropriately. The next question is, do you have to qualify for these procedures? For example, do you have to be a certain weight? For medications, your body mass index, so your weight divided by your height in square meters, and that you can go to online and check what's your BMI, body mass index. So your body mass index for medication is to be above 27 if you have a comorbidity such as diabetes, hypertension, cholesterol, heart disease, obstructive sleep apnea, and so on, or above 30. For the endoscopic procedures, such as the intragastric balloon or the endoscopic sleeve gastroplasty, you need to have a BMI above 30. For bariatric surgery, your BMI needs to be above 35 with comorbidities or above 40 without comorbidities. And those are usually the criteria to qualify for these procedures, but certainly it's something to discuss with your physician or obesity expert. And I see another question coming. I have always been thin, but have gained weight in menopause. After specific advice for weight loss or management in this instance, yes. So we understand that women go through many changes in menopause. Your metabolism slows down. There's probably something related to the microbiome as well as your energy expenditure with all the changes in your hormones that you're going through. So what we're trying to say to patients who are going through menopause is, if you're not exercising, adopt exercise into your routine. And it has to be a combination of cardiovascular exercise with resistance, with weights and so on, training. That has been two things that works the best for patients with menopause, but that doesn't mean that patients with are going through menopause or gain weight during menopause cannot also adopt a tool such as a medication, an endoscopic procedure, or surgical approaches for weight loss. All right. What diet would you recommend? That's a very simple question that most of us are thinking, and there is not a right answer. When we have done the studies and look at what diet is the best for patients, turns out that the best diet is the one that the patient likes, the one that you can stick to it and go for a very long time. So if someone doesn't like salads, why should they do a salad containing diet if that's not their favorite? So, and in the big studies have shown that when they compare the multiple of the commercial diets, is that the only key to success with the diet is adherence, one that you like and you can stay in for a long time. So my best advice for the diet is focus on find something you like individually, what is the things that you can eat, and then focus on the amount of calories that you need to eat. The guidelines tell us if you're a woman, between 12 to 1500 calories a day. If you're a man, between 1400 to 1600 calories a day. Or create a 500 calorie deficit depending on what's your caloric needs that you need for each day. So first I will start with the number of calories that we need to eat and then try to find something you like. I personally, for example, I like a high protein diet with normal amount of fat and low carbohydrates. But that's a little bit my own preference, so I will not endorse one versus the other. Let's see if we take one more questions before we wrap up today. All right, the question is, what if you're allergic to many foods that doesn't cause you to gain weight? Yeah, so if you have multiple allergies, that can be contributing to weight gain. Also, many of the allergies medications tend to produce weight gain. So again, if you have to be restricted to what foods you can eat versus what not, I will stick to the calories and number of calories a day, as well as to the physical activity before trying to find out very specific type of food that might be triggering allergies. So these are all been terrific questions. Thank you for all our audience for sending us. We will continue to answer them in your comments on Facebook. Feel free to keep posting questions or comments. We're happy to keep following them. I think on summary, I think it's important that if we want to adopt weight loss as a New Year's resolution, and we have tried in the past, I will highly recommend that we consider adopting a tool that it can be either a medication, an endoscopic procedure, or surgery if we need a little bit more help. These tools help fight back what makes so difficult for us to lose weight, and we have great success with them. And if you decided to do that, look for a program that has a multidisciplinary approach like the one we have here at Mayo Clinic, that those are the ones with the best success. So thank you for your time. That's all that we have for today. Thank you for joining us. If we didn't get to your specific question live, we will follow up after the broadcast. Thank you. Have a great day and happy holidays.